You extubate a patient, what is the first thing that they usually ask for? Water. Every single time I extubate a patient, the first request they have 9 times out of 10, I would even say 9.9 times out of 10 is, can I have water? My answer is no. Just kidding. I don't just say no. I say not yet, and I explain why, and I'm going to talk about it here. When someone has a breathing tube in, it sits right near those muscles that also control our swallowing. So patients that have breathing tubes in, especially over prolonged periods of time, can have some decreased function with their swallowing after we extubate them. A lot of times this is just a temporary thing. It's something that we can evaluate the patient for with speech therapy and help them over time kind of recover that swallowing function. But a lot of patients, when they get their breathing tube out, their mouth is so dry, they're thirsty, they want to drink, and they're like, give me all the water. And we're like, sorry, I can't. So I always like to go slow after somebody's extubated. If someone wants water, I'll start with some wet swabs and kind of just like get their mouth a little bit more wet. After a couple hours go by, I may do some ice chips and then progress to doing small sips of water. But you always want to perform a bedside swallow evaluation before you give your patient any PO intake. Every hospital is going to be different. Some hospitals, if you've been on the ventilator for like, let's say 48 hours, they automatically will consult speech therapy. Sometimes they just require that you do a bedside evaluation first, and then if you notice any issues with the patient swallowing, then consult speech therapy. So definitely make sure you check with your hospital's policy in regards to this. But regardless, we need to be super careful after a patient's breathing tube comes out with allowing our patient to intake PO. I'm curious, what is your policy at your hospital? Is it a certain length of time on the ventilator? Do you guys do a bedside swallow evaluation? What do you do? And if you want more information on bedside swallow evaluations, let me know.